You don't rush off and get expensive screening tests alleged to be more sensitive, more specific. There are a number of them. There are blood tests, there are urine tests, genetic testing. The problem, all the testing, shades of gray. All you're going to get out of that is a percentage of likelihood that you have an aggressive cancer. It's not much more information than you had before you did the test. And all the tests are going to funnel you into the decision about getting a biopsy. Don't let them scare you into doing something you may later regret. I call it PSA paranoia. So many men are focused on that number. And I get it. It makes sense. It's a tangible number and it has some relevance. So what is PSA? The prostate-specific antigen is produced primarily in the prostate gland. It's normal for it to be in the bloodstream. As we get older and as a prostate gets bigger, we make more of it. So the PSA number correlates with the size of the gland. It's an important detail. The number can vary depending on the condition you're in, and it's been utilized, many feel inappropriately, to channel men into a fear-stimulated pathway of biopsy and aggressive interventions. PSA elevation does not mean you have cancer, and a PSA elevation does not mean that the cancer is necessarily progressing. But it could be, and that's the conundrum. So I'm going to talk you through a rational, intellectual medicine, Petteruti Protocol approach to a rising PSA. Here's what I do for my patients and what I recommend you do for yourselves. The first thing, if your PSA is trending upward, is to take a breath. Do not do anything interventional. Do not allow a biopsy to take place just because that number went up. Whenever there's a lab test that is skewed, abnormal, or otherwise questionable, first thing you do is you repeat it. So your PSA was stable and now it just jumped up. Now, what does a jump up mean anyhow? It can trend upwards slowly. Nobody knows exactly how much of a change should draw our concern with regard to cancer. So they've estimated it. These are all speculative guesses. The total number of 4 is a complete guess. That is, in a lot of things you guys read about, it'll say, well, if your PSA is above 4, that's abnormal. That's a fallacy. Number one, it goes up as you get older. The average PSA for a man over 70 is around 6. Number two, the bigger your prostate, the higher the PSA. So getting this equilibrated based upon the size of your gland is important. For a PSA, the average size is about 30 milliliter for men 60 and above. How do you know how big the prostate gland is? Usually it's estimated with an MRI, sometimes an ultrasound, not a CAT scan. CAT scans are radiation, guys. Radiation causes cancer, so avoid it. But if there's a question about your PSA, step one, repeat the study. And if it's a consistent, steady elevation, if it increases by 2 points or more in a short interval, say 3-month interval, maybe worth attention. If it doubles in a year, went from 5 in November of 24 to 10 in November of 25, it's worthy of some attention. So now you've made sure that the number's real. I've seen cases where one number spiked for reasons we couldn't discern. You get another number a week or two later, and it's down 3 points. It's reassuring. So get the number validated. That's one step. Suppose no fooling, this number is elevated. The next thing that you want to do is get a prostate MRI. I recommend it without contrast. The contrast they put in you makes the picture easier for the radiologist to read, but it's not critical for the purposes we have in mind. We want to know how big is your gland, and we want to know, are lymph nodes involved, or is there evidence of cancer percolating within it? And most importantly, is there evidence of cancer pushing beyond that gland? It is uncommon, in my experience, to have a man with a PSA level greater than 4 with a prostate gland that is stone cold normal, nothing going on here at all. So the prostate MRI, worth getting, but once again, be careful how it gets interpreted and do not overreact to it. So you get a prostate MRI. Now you know how big the gland is. You know what your PSA number is. The average PSA level does correlate with the size of the gland. And you get that. It's a formula to multiply the size in milliliters by 0.15. And that gives you a corrected PSA level for the size of your prostate gland. Size of the gland times 0.15 equals a PSA number that should be approximating it for benign prostatic hypertrophy, BPH. Now, if you're in a pathway of increasing PSA levels, in my protocol, we do not castrate you. We do not put androgen deprivation therapy into play. So when we talk about what to do with your PSA number rising, it's equally important to talk about what not to do, because the conventional approach with a rising PSA with a diagnosis of prostate cancer is to interpret that as a biochemical progression or a biochemical recurrence. I believe this is a fear-inducing fallacy. The fact that the number's going up is self-evident. But does that mean that the cancer is now marching forward? And more importantly, does it mean that you should allow aggressive treatment to take place? Not when you're feeling good, not when you're having no symptom. Doc, I feel great. My urinary flow is good. I'm not having any bone pain. I'm feeling pretty good here. Oh, but Mr. Smith, your PSA went from 4 to 8, went from 3 to 5. We must treat you with androgen deprivation therapy. We have to do this. Otherwise, you're going to die from, right? This sound familiar to some of you guys? It is fear-mongering. Instituting drug therapy that absolutely causes harm, androgen deprivation, castration therapy, 100% will cause some harm. To introduce that therapy in a setting where you feel good and the PSA is going up is to put speculation ahead of tangible evidence. The only time that I support the use of androgen mitigation, not castration, it's a different thing we do it with the Petteruti Protocol. We mitigate, we don't castrate. Remember the focus. Fight cancer like a man. You cannot be fully masculine, guys, with your testosterone being squashed to nothing. That's not what men are made of. We need testosterone, and if we don't have it, we're not fully ourselves. Not just sexually, mentally, physically, emotionally. It is a critical hormone, and we are deprived of it at great risk. So never would I recommend it just because the number went up. Now we're treating a lab. Now we're not treating a person, are we? We're treating a lab study. Wait. Not only do you delay, possibly fully avoid all the negative consequences, but when you introduce castration therapy, when it's introduced into your treatment, the clock starts ticking. Within 1 to 2 years, the cancer will become resistant to castration and will progress despite the castration being present. That is ominous. The term for that, castration-resistant prostate cancer. And at that point, Katie bar the door. It's now going to progress. So you hold off, you hold off, you hold off. If the cancer creates symptoms, you can't pee because the prostate is now encroached upon by a tumor. You're having bone pain because a prostate cancer is now somewhere in your skeleton. Then you treat it, and then it's going to work. So you don't start treating it today because your PSA number went up and your doctor's telling you, we want to prevent it going to your bone. It's never been shown to do that. That is a pure speculative hope. You do not implement speculative hope at the price of castration, guys. It's not worth the price of admission. Yeah, I get it. The notion of cancer going to the bone is terrifying, but doing something with a hope that it'll make it less likely to occur, conventional medicine, that's crazy. Furthermore, we know that if it's in the bone, that introducing castration mitigation therapy at that time is highly effective. So this idea that you're going to go to your bone and then you're going to burn up like a house on fire, even with minimalist therapies, when the prostate cancer hits your bone, your still median survivals are outward of 4 years and above. Now, I don't consider 4 years to be adequate. I'm on board with you guys. We're looking for outlier results. So your PSA is going up. Step one, take a deep breath, get it retested. Now remember, guys, when you get your PSA done, your condition at the time of the test is relevant. If you're sick, you have a head cold, don't get the PSA done, it's going to be elevated. Inflammation makes it go up. Don't go on a bike ride the day before. Don't have sex the day before. Don't have alcohol the day before. Be well hydrated as best you can, well rested. These conditions matter. And if possible, try to use the same lab. There are at least 4 different companies that make a PSA test. And they each have their own proprietary reagents that they use for the purpose of the test. That means you could take the same blood sample and get 4 different numbers depending on which lab did the test. So it's helpful to have consistency with the lab. So verify with repeat test. Consider getting a prostate MRI. Then you're going to pause. If you're feeling good, wait another 3 months. This is a slow-moving train. I've seen men get so nervous, and I know you can do this. You can pay money on your own and you get the PSA done. It's not worth your price of admission because we need time to make logical, intellectual interpretations. So I advocate a 3-month gap, at least a 1-month gap before you look at that number again. Another thing that I recommend you don't do, you don't rush off and get expensive screening tests alleged to be more sensitive, more specific. There are a number of them. There are blood tests, there are urine tests, genetic testing. The problem, all the testing, shades of gray. All you're going to get out of that is a percentage of likelihood that you have an aggressive cancer. It's not much more information than you had before you did the test. And all the tests are going to funnel you into the decision about getting a biopsy. We start our reflections with the conclusion that biopsies are bad for you, that we don't want you to get them ever, that they have the potential to spread cancer, that they elevate your PSA, they cause harm, guaranteed harm. It hurts, could get infected, a lot of bad things. And that stupid Gleason score. I don't mean to disparage the guy. He's probably a very nice man. I think he's no longer with us, but he invented pathologists looking at the cells, describing what they look like. Okay, it's interesting. Nice research project. But does it really have value to help you make decisions? Very little, almost none. The Gleason score, a biopsy, does not predict what will come next. It's not a crystal ball. You can't tell how aggressive it's going to be in the future based upon a moment now. What is needed is sequential evaluation. So PSA, yes, gap it out, repeat it. A biopsy, do not let them scare you into it. An MRI, yes, it's got a role here, right? It can give us information about the size of the gland, about its appearance, how likely it is to be cancer or not. All that can be discerned with an MRI without a biopsy. And when all else remains ambiguous, the prostate-specific membrane antigen PET scan is an option to contemplate. I don't advocate this in the absence of symptoms, guys. It's radiation exposure. You want to reserve that for when it's most critically needed. So PSA is going up. Know the formula. How big is a gland in milliliter? Multiply by 0.15, give you a corrected PSA level. Consider just repeating the test and monitoring it as long as you're feeling good. Now you should be doing something, but not biopsy. Now you should be doing something, but not chemotherapy, not castration therapy. That goes to the heart of the matter with the Petteruti Protocol. Fighting cancer like a man, monitoring the PSA, trying to keep it blunted, and if it does go up, interpreting it rationally. All right, guys, I hope that gives you some insights to the PSA and how to handle it when it's going up. Most important advice, pause, think. Don't let them scare you into doing something you may later regret.